City of Hope hour on your hometown station, KHTS. I am Kyle Jellings, and I have Mandy Eglseder.
Getting it every time.
Eglseder.
Yeah, good job.
And we have Dr. Dortha Chu, and we are talking about specifically breast cancer, but I want to touch a little bit on, you can go to cityofhope.org/Santa-Clarita to learn more about the facility here. But Mandy, just let's reset, and what are the different things that people offer, or people have at City of Hope, City of Hope offers? That was the weirdest way to ask that question.
It was.
Sorry.
You know, we're not judging. This is a non-judging circle.
That's right.
We offer a variety of services from medical oncology, hematology, breast oncology, gynecological oncology, different types of surgeries. We have a general surgery, we have urologic surgery, so a variety of different services. Not only do we specifically focus on cancer, but we also, in our local office, we do offer general urology services and general surgery. So,
in terms of maybe from like an outsider's perspective,
sure.
you're sort of an outsider, not really, but in terms of research, the research that goes into at City of Hope, can you talk just a little bit about that and just the type of research that they do there, and how they're always, like Dr. Chu was saying, that you guys are always willing to trying to learn more?
Yeah, I mean, as far as the research that we do on campus, I mean, I don't even know where to start. There's so much more.
I'll help you a little bit. I was going
to
to say, maybe I can help with that a little bit. So we run the gamut from very, very basic research where you're just all theory, we're just guessing, all the way up to clinical trials where there's specific therapy that we're looking to see how effective it is. And there's physicians, there's scientists working at all those different levels, and we all collaborate to make to go from that very basic idea, could this work, all the way up to, oh my goodness, can we actually cure someone with it? And that's the great thing about City of Hope, is that we actually have that full spectrum going on all the time, constantly on the main campus. Those of us in the community, we don't necessarily do a whole lot of that initial phase, that basic phase, but we are very involved in the clinical research side. So if the patients need or fit criteria for clinical trials, that's one thing that we can do that's different, is that we can offer that as potentially part of their treatment plan. And that might require, those are the times when you might require for you to go to Dortha for some of your treatment or management. But because the local physicians are involved, we can coordinate that a little bit better.
Gotcha. Okay.
And so it gives you that flexibility. For
it seems like all the doctors at City of Hope, this is like the research part is kind of the exciting part for the doctors. Helping people is one thing,
Sure.
but you are helping people because you're kind of trying to change the world, as Eric Clapton was just saying. So,
yes.
But again, we're speaking with Dortha Chu, Dr. Dortha Chu, and Mandy Eglseder of City of Hope. Go to cityofhope.org/Santa-Clarita to learn more. But I wanted to talk about specifically you said second most common cancer in women, which is breast cancer, which is your expertise.
Yes.
And I mentioned in the previous segment that my grandmother about 25 years ago had a double mastectomy. How has we spoke a little bit, maybe let's talk about a little bit how to find it, how women, different ways we can find breast cancer, and then maybe the way treatment has changed as well.
Absolutely. Well, the most important thing about screening is getting the right imaging and starting at the right age. There's a little bit of controversy lately about what age you should start getting that annual mammogram, and that really is the most crucial part, is that annual mammogram. It's still our best test to find cancers even before they're large enough for you to feel or have any other signs. So
can I ask, is that people obviously, the one reason they're scared to do it is because they may have cancer, but is it painful? I have no clue when it comes to, but I'd like to put people at ease who are thinking about doing it. What is that process like?
Sure. Well, without getting too graphic, it does involve physically placing the breast in the mammogram machine, and that does involve some compression of the breast in order to get appropriate image of the internal view of the breast. So there is some discomfort involved. I'm not going to lie. It's not the most comfortable thing you're ever going to do. It shouldn't be painful. If it's painful, I advise patients let your technician know, because then they can adjust. Okay. It should not be be painful, but it is a little uncomfortable. But we're talking about a couple of seconds. We're not talking standing there, for 5-10 minutes. We're talking a few seconds at a time, a little uncomfortable, and it can save your life. It can literally save your life, because if we find something at that point where it's only visible on the mammogram, at this point in our ability to treat, that's almost 100% guarantee will be curable.
Wow, that is good news.
But any
we
later
need to
than that,
re-emphasize
absolutely,
that 100%
absolutely.
curable if we find it that early on.
Absolutely. But if we wait until something is physically felt or there's other signs, then we're talking about much more advanced disease. We can still cure a lot of those, but it's a lot more difficult, and there's a lot more that the patient has to go through in order to get there. But still very treatable.
And so in terms of age, you said that we're not really sure. I'm sure it has to do with, like, for example, my mother, who has been going as long as I can remember.
Sure.
Which is good, right? But because my grandmother had breast cancer, so I'm wondering,
Right.
what is the age if you have no prior history, or even if you do have prior history, what is the age?
Right. Well, we have been recommending for all women, regardless of any personal history, to start their screening mammogram starting at age 40 for a very long time. Because studies have shown that that's, between 40 and 50 is when we start to pick up cancers. They're still fairly rare in that age group, but that's when we start to pick them up. After age 50, it really is when the number of patients diagnosed with breast cancer start to really go up. So certainly 50 or older, I absolutely would recommend that a woman get an annual mammogram. Between 40 and 50 these days, because the risk is still fairly low of developing a cancer during that age, there's a little bit of leeway in terms of having to do it every year. Having said that, if you think you might have a higher risk, either personal history or family history, then we do recommend that you start at age 40 or even younger, depending on your actual history. That would be something I would strongly encourage a woman to discuss either with her family doctor, primary doctor, or gynecologist, so that they can assess that risk for her a little bit better to see if she needs to be in that age group where she really should start at 40, or if she can have a little bit more flexibility.
Gotcha. Okay. So there's the mammogram.
Yes.
Is there other things, like, I mean, obviously, if you feel something, then
Sure.
have that taken care of. But is there other things that women can do in order to help with diagnosing it, or
Absolutely.
Maybe, and we can get into maybe some preventative stuff later, but
Sure.
Is there stuff that to figure out?
Absolutely. I'm a big believer in the breast self-exam for a woman. There's, again, a controversy in terms of should that be done? Is it helpful? It is if you
There's
are doing it for
controversy?
the right reasons. I'm sorry?
There's controversy?
There
With
is,
trying to-
because because honest answer is most women are probably not taught how to do it
Oh,
appropriately,
okay.
and so they're not doing it right, quote unquote.
Okay.
And so there's a thought that if you're not doing it right, you're not really doing much to help, and it may
Okay.
even make women scared about their own breast. My take on that is, if you are interested in doing this for yourself, I think it is actually one of the main things a woman can do for herself. And the whole goal of doing a self-exam is not to find something. That's not your job.
Yeah.
That's my job. It's actually for a patient to get to know her own breast, get to know her own body.
Okay.
Because lots of times it's that change from normal that really can make or break a diagnosis.
Gotcha.
Especially in a woman who maybe isn't quite old enough to get that routine mammogram or haven't been getting a routine mammogram, realizing that there might have been a change in the breast and that's going to prompt you to go see a doctor. To me, that's really what the whole point of doing that self-exam is.
Okay.
Not for you to find something. The vast majority of things that patients identify on self-exam are not going to be cancer.
That's good
The vast
news.
majority of lumps are not going to be cancer. But you won't know that unless you present to a doctor to have it evaluated appropriately.
Gotcha.
So I'm a believer in doing a self-exam every month, and to do it regularly every month, so that what you're really checking is everything feels the same.
Gotcha.
The same is
Okay.
normal.
Yeah.
A change.
No news is good news.
No news is good news,
Yeah.
exactly.
Yeah.
But if you should feel a change, don't panic. Just get yourself into a doctor's office so they can take a closer look and make sure it's not a problem.
Okay. Okay. So those are a couple ways. I want to talk. I want to move a little bit into treatment.
Sure.
Is there a point where there's different stages of breast cancer?
Absolutely,
I assume.
yes. So there's very early stages where it's very small, hasn't gone anywhere else, it just stays in the breast, ranging all the way up to the cancer has spread to other parts of the body and other
Okay.
body organs.
Okay.
Depending on where you are during, sort of in that spectrum, treatment can be easy or hard, or easier or harder.
Yeah.
And so certainly you want to be in the stage where it's as small as possible and limited in terms of where it is, and that's early stage.
Okay. And so, what are some of of the treatments then for breast cancer?
Great. Thanks for bringing that up again, because I think that's really the key issue here is that a lot of women think that they have to go through a lot in order to have breast cancer treated and be cured. And these days, that's just not the case. We don't have to do mastectomies anymore. The vast majority of patients that I do see with early stage cancer, we can just remove part of the breast just with the cancer in it. And for a lot of them, they won't even notice much difference afterwards in terms of the size of the breast or the shape of the breast.
Really?
Absolutely. And so cosmetically, it's great. And also from just a cancer treatment perspective, it works just as well.
That seems like I don't know how my grandmother felt after it, but that seems like cosmetically that seems like a big advancement.
It certainly can be for most women.
Yeah.
If you want to keep your breasts, it's certainly a great option, and we could do that. Again, in the vast majority of patients with early cancer, that's absolutely doable. In those with more advanced cancers, if they want to try for preserving their breast, there's some things we can do that might allow us to do that. There are times when that's just not possible because of the amount of disease, and we still do mastectomies. So it's still a treatment option, but it's certainly not the only option.
Okay.
There are some patients who choose to have a bilateral mastectomy these days. And so in a way that's becoming more popular, quote unquote, not because it treats cancer any better, but because of a fear that some women have, where they just don't want to deal ever again with this diagnosis.
Really?
And so they choose to have a bilateral mastectomy. And our reconstructive efforts have gotten so much better with plastic surgeons that, for those who choose that option, we can kind of recreate the breast well enough that cosmetically they feel comfortable with the results. So it's becoming a popular choice rather than necessarily a medical choice.
Gotcha. Okay.
There are some cases for patients who might have a genetic risk, and then those patients then might want to proceed with a bilateral as a preventive, but that's only in those cases where there's truly a very high genetic risk for that patient, and that's something we can evaluate and determine before they jump into that step. So it's relatively rare these days that we have to do a bilateral mastectomy.
Okay.
But it is still done.
And so, is there a certain stage in? So, if you as a breast surgeon,
yes,
if it has spread to other parts of the body, does that mean like multiple surgeries, different parts of the body, or does that mean try chemotherapy? Like, what's the situation there?
Well, let me answer it this way. These days, treatment of breast cancer is not just with surgery. In fact, every woman, regardless of your stage, will have some surgery, typically, some radiation, and some kind of medical therapy.
Oh, okay.
And so every woman, regardless of stage, is going to have some combination of those three things, depending on their individual cancer and stage. Certainly in the more advanced stages where it's gone to other parts of the body, that surgery becomes more limited because I can't remove your liver or whatever that's involved. So systemic therapies like medicine or sometimes radiation is a little bit more appropriate in those circumstances, and surgery may take more of a back seat. But those are the decisions that a team of doctors would make once you get diagnosed, and that's what we have at City of Hope. When you come see me, even though yes, I'm the breast surgeon, it's not just me. You will have a team around you of a medical oncologist and a radiation oncologist, and the three of us, along with other support services like a nurse navigator that we have, who's going to help us and help the patient navigate through this entire process, as well as other medical professionals that we're involved with. But as a team, we make sure that you know what your options are and how those apply to your individual disease, and we tailor your treatment to your stage, to your type of cancer, and even to the patient's own psychosocial needs. What kind of fear do they have? How do we address that? Do they have some factors that might increase their risk down the line? We address those. So it really is a big team effort, and we personalize that treatment as much as we can for the individual patient. But we don't have to do as much as we used to, but the range of options have become so much greater.
This is the City of Hope Hour on your hometown station, KHTS. Mandy Eglseder is with us, as well as Dr. Dortha Chu, and we're talking breast cancer specifically. I don't know if there's anything. I feel like, well, maybe there is. I'm just going to ask you because you're the doctor. In terms of preventative other than, checking yourself and
Sure.
going doing your mammograms and stuff like that, is there anything preventative that you would suggest in terms of with breast cancer?
Absolutely. The number one risk factor that a woman can actually control to a certain extent is smoking.
Really?
Yes, we know smoking.
That was just lungs.
I know everyone thinks that it's lungs, it's the heart, but it actually does increase significantly your risk for breast cancer if you are a long-term smoker or have an extensive smoking history. So if you quit smoking, you can significantly reduce your risk to the point that after 5 years, you're pretty much back down to the same as if you never smoked. That's where your risk would fall. And so it really does. So it doesn't matter how long you've smoked, doesn't matter what age you are. It's still important to think about quitting if you are willing to do that.
Just don't do it.
Just don't do
Just
it.
don't.
Don't start. But
Yeah.
if you started, we can help
Just
you
stop.
quit.
Just stop. It's just easy. It's that easy.
No, it's not easy.
No,
Granted, it's not easy.
No.
But if you can, that is the only thing, to be honest, that most women can, or anyone can do
Yeah.
for themselves, is that those kinds of things they can change. Diet to a certain extent. We do know that people who are significantly overweight do have a slightly increased risk for breast cancer.
Okay.
Again, with other cancers as well. But when we're talking significantly overweight, again, that's something that would need to be evaluated on a person-to-person basis. But eating healthy is never a bad idea.
Yeah.
There's no specific food. I hate to tell people that. There's nothing that you have to specifically quit or take. But in general, staying with a healthy diet, staying in a healthy weight is a good idea for breast cancer prevention.
And we're speaking with Dortha Chu, doctor. She is the breast surgeon over there at City of Hope. This is City of Hope Hour. Also speaking with Mandy Eglseder, and she is the physicians relation liaison. And I wanted to ask you this. This is the last question I'm going to ask you before our break, and then we're going to last section here. We're going to have some fun, whether you guys like it or not. But I wanted to ask you. This is a really difficult field to get into. This is because you could have been, a foot doctor, like a podiatrist or something.
Fair enough.
And there's not probably a ton of family that's affected by. And again, I don't want to put down people that fix
Fair
my
enough.
foot. So, but you understand what
Yes.
I'm saying? Is this a difficult field of medicine to be in? Why
Yes.
did you choose this one? Why what? Because you could have been you just continued being a general surgeon.
True.
Why did you choose to help this particular type of medicine?
Because I think this is one of the fields where we're making so much progress that people are surviving it. And I want to be a part of that. I want to be a part of that survival, that survival drive as well as survival benefit. It gives people hope, and I that's part of my day is when I can give somebody hope that I know it's in our name, but it really is that this is not a death sentence. It doesn't have to be, and you have options, and to be able to tell somebody that, to take away the fear of that first initial diagnosis, that's the best part of my day, to be honest. Even before I even touch them or do anything with them as far as their disease, just having that initial conversation and being able to help them with that fear is so rewarding. I can't imagine doing anything else.
And so, Mandy, I wanted to ask you kind of the same question. You worked with the American Cancer Society, right? Mm-hmm. And that was kind of on a bigger, grander scale, right?
Right.
And you said you got into City of Hope to get more help with the patients, right? I don't want to misquote you here.
No, specifically connecting the patients to our physicians.
Yeah.
So I'm obviously not a doctor, and I don't have that extensive background in the research or anything like that. But for me, it's the passion of driving down the percentage of death rates. It's a treatable disease, and I want to be there to inform the community that you have people here to help, and I want to be part of that process. It's something that's very important to me.
Awesome stuff. Again, go to cityofhope.org/Santa-Clarita. Check out the facility over there, right across the street from City Hall in Valencia, and right above where my kids go to the doctor.
Oh,
Perfect. But make sure you go check them out, cityofhope.org/Santa-Clarita. Again, if you have been diagnosed with cancer as well, go over there and they can give you a second opinion. They may have some more information that you could help you, or they could just put your mind at ease and say, yeah, your doctor's right. So
absolutely, and we're always happy to do that.
yeah. We're going to take a quick break. This is City of Hope Hour. We're going to have some fun. We got the KHTS Fast 5.
All right.
I don't know. I don't think I've done this on this show before, but the KHTS Fast 5 coming up next on the City of Hope Hour on your hometown station, KHTS. Santa Clarita's hometown station, KHTS. I am Kyle Jennings. This is the City of Hope show on your hometown station, KHTS. We're speaking with Mandy Eglseder, and we also have Dr. Dortha Chu, and we've been talking about serious stuff for the last hour or so. Again, go to cityofhope.org/Santa-Clarita to learn more about what City of Hope has to offer. Really great organization here in the Santa Clarita Valley, right across the street from City Hall in Valencia. It's on the second floor, right? Second floor. All right, second floor. So second floor in there, so you can go check out their facilities. But now it's time to have a little fun. Whether you guys like it or not, I'm going to force you to have fun. It's like you're my kids. I'm forcing you guys to have fun. So this is the KHTS Fast 5. This has nothing to do with what we've been talking about, but you should listen to the show. Go back and go to hometownstation.com, listen to the show. Really great information about breast cancer prevention, treatments, and really just helping you put your mind at ease with really any type of cancer, but specifically today we talked about breast cancer.
Yes.
Which is your area of expertise, Dr. Chu. So this is the KHTS Fast 5, and here we go. You guys ready?
I think so.
I think so.
I'm going to ask you both. Who wants to go first? Oh, you just pointed at each other. Okay, I'm gonna start with Mandy's the first card I saw down here, so I'm gonna go with Mandy. Okay. If you didn't have to sleep, what would you do with the extra time?
I would go paddleboarding, hiking, and camping.
At nighttime?
Yeah, all the time.
Okay.
Yeah.
All right.
Sure.
That's fine.
And eat cheesecake.
Okay.
All right.
Well, you'd be doing all that exercise.
Yes, exactly.
So you'd have
balances out.
And eat cheesecake. All right. Doc, what about you?
I would spend it with my dog.
Oh, okay.
Yeah.
That's
I
all
would
right.
spend it with my dog.
All right. Doctor, I'm going to start with you on this one.
Okay.
What job would you be terrible at?
That's hard.
Oh.
Because I would be terrible at most other jobs other than what I do. I really believe that. So I think I stumbled on the right thing.
Okay, all right. So you found your calling.
I think so.
You'd probably be bad at everything else. is what you're
Exactly. I probably would be bad at just about everything else.
Okay, good. Just to emphasis on, you're really great at your job now.
Well, I like to think I'm very good at my job now.
Okay. Mandy, what do you think?
This is a hard question. I was just trying to think of the most miserable job. And the first thing that came, this is off the chart.
If you say radio host,
No.
I'm going to hurt my feelings. But go ahead.
That was not on my list at all. For some reason, the first thought that came to mind was working at a dog food factory. I don't know why.
Okay. Yeah, all right. That's fine.
I need a job where I feel passionate.
Okay,
so
gotcha.
I don't think I would be passionate working at a dog food factory.
Noted. Okay. Noted. Aliens just landed in Santa Clarita. Where are you giving them a tour? You're in charge of giving them a tour. Where do you go first, Mandy?
I am going to take them to Thursdays at Newhall.
Nice, right outside.
And then we're going to get some barbecue at Southern Smokehouse.
There you have it. Okay.
Nice. Well, I've only been here for, I was going to say, well, for me, I've only been here for a few months.
Okay.
I'm still learning. But I really liked Central Park.
Okay. Yeah.
It's beautiful.
Yeah,
Beautiful
that's
park
lovely.
that we have. Yeah.
Lovely. What are some of the small things that make your day better, Doc?
A hug from a patient.
I believe it.
Yeah.
That seems like, just so you know, that's not a little thing. That seems like a big thing in your field of work.
Well,
but that's a win for sure.
Absolutely.
Absolutely.
Always makes my day.
Hugs, I
Just hugs in
agree.
general?
Hugs in general are great. Making people laugh and smile and just feel happy.
Awesome.
Those are little
All
things
right,
I love.
fantastic. All right, we have about a minute left.
Okay.
This is the final question. What is something that that is considered a luxury, but you don't think you could live without? I'm going to start with you, Doc.
GPS. I would be lost without
That's
my
a
GPS.
good one.
We were just talking about that before we came. If I didn't have GPS, I would be lost.
That's
I'm
a really
with you
good
on
one.
that. I would be so lost. What do you think, Mandy?
I keep on going back to food. Donuts
Is it
and
lunchtime?
I think so. I think I'm just hungry, but donuts, ice cream, and craft beer.
There
I
you
don't
go.
think I could.
Oh,
Yeah.
okay.
All right.
I'll give you that too.
There you go. All right. Thank you guys so much for coming by. Appreciate
Thank you
guys.
so much
Again,
for
go to
having us.
cityofhope.org/Santa-Clarita to learn more about City of Hope and all the things that they have to offer. This has been the City of Hope Hour on your hometown station, KHTS.